Hi everybody, this is Rich Sanders with Southern Health Lawyers, and welcome to the Health Law News Nugget for March 6, 2018. The News Nugget is a weekly summary of the most important events that have affected the healthcare industry and business and politics, and is watched by hospital administrators, physicians, physician practice managers, and folks that participate in the industry all over America. We very much appreciate you watching. Well, everybody, this week was dominated by the opioid epidemic. For starters, at the federal level, the U.S. Department of Justice initiated a task force to combat the opioid epidemic that I think is a stab at dark humor by the DOJ. It's called the Prescription Interdiction and Litigation Task Force, otherwise known as PILL. Well, the PILL Task Force has two standing orders, according to Attorney General Jeff Sessions. The first is to combat the opioid epidemic nationwide by going after manufacturers and distributors of these prescription drugs. The second is to get involved in existing litigation where appropriate that municipalities and county governments have launched all over the nation. So on the same day that the Attorney General announced the formation of the PILL Task Force, the Department of Justice filed a document with federal court in Ohio where multi-district litigation has been consolidated by these municipalities against the pharmaceutical companies, and asked the judge for time to consider whether it will join. This is a big development because the Department of Justice, at the federal level at least, has not joined these cities and counties in these actions against manufacturers up till now in this litigation in Ohio. The Attorney General said that 180 people a day pass away from the opioid epidemic, and the impact is felt nationwide. So the second subject that the Attorney General took on was asking Congress for some additional action, some additional legislative support for the PILL Task Force by rewriting existing laws that would make it easier, for instance, for the Drug Enforcement Agency, or the DEA, to take action to stem the tide of opioid abuse in America. This seems to be getting some traction as the Senate Help Committee Chairman, Lamar Alexander from Tennessee, whose committee had already been having hearings on the opioid epidemic, responded favorably and then scheduled additional hearings for this coming Thursday, March 8th, where the Help Committee will be hearing from states on how they have developed innovations to address this problem. So at the federal level, at the state level, and at the city level, including New York City. Our last news event from last week is that Mayor Bill de Blasio from New York announced that New York City would be joining this now growing tide of litigation against opioid manufacturers, claiming that New York City had been damaged to the tune of $500 million as a result of folks who had been addicted to opioid and prescription drugs who were seen in the New York City Public Health Department. So it's a big issue of discussion in Washington and around the country for politicians. Remains to be seen how this will affect opioid manufacturers on Wall Street. Thanks for attending the Health Law News Nugget this week. We appreciate you watching and look forward to talking with you again next week.